Once again, this disease has become a global outbreak, much like in 2022 when a crisis was declared. In the video I recorded back then, I explained everything about this disease and mentioned that there wasn't much to worry about. I noted that we were closely monitoring the situation and that the outbreak would likely be stopped before it could spread too far. Indeed, just a few months after that video, the outbreak ended, the emergency declaration was lifted, and now here we are again. This time, things are a bit different, yet somewhat the same. Since YouTube isn't very good at promoting older videos at the right time, we'll have to do a crash course on this again. We'll also discuss some of the elements that make this outbreak unique. If you're ready, let's begin. Monkeypox was first identified in humans in 1970 in the Democratic Republic of Congo during a period when smallpox was being eradicated. Initially, it was considered a rare zoonotic disease, primarily affecting remote areas in Central and West Africa. Over the decades, sporadic outbreaks occurred, but it wasn't until the 2022 outbreak that the world saw its potential for widespread transmission. Now, in 2025, we face a new challenge with this virus, and it's crucial to understand its history to tackle the current outbreak effectively. The monkeypox virus, as the name suggests, is closely related to the famous smallpox virus. Thanks to vaccines, smallpox became the first disease we were able to completely eradicate from the planet. Therefore, we know these viruses very, very well. These viruses belong to the Poxviridae family, and they're often named after the species in which they were first isolated, rather than the animals they infect most frequently. For instance, we call the pox virus found in cows cowpox, not because it infects cows the most, but because it was first discovered in cows. In reality, cowpox is more commonly found in rodents and can even be transmitted to humans via intermediate reservoirs like cats. Similarly, monkeypox was first discovered in monkeys in 1958. For example, this image isn't of human skin, but of a macaque monkey's skin. Since we identified and isolated the monkeypox lesions in monkeys, we call it monkeypox. However, the virus is more commonly found in African squirrels and pouched rats. So don't get too hung up on the name, and don't worry, just as nobody grew a tail from getting the COVID vaccine, you're not going to turn into a monkey if you catch monkeypox. After all, you're already a monkey, but that's a topic for another video. Generally speaking, we refer to diseases with similar symptoms and transmission methods as pox-like diseases. By the way, don't confuse smallpox viruses with chickenpox. Chickenpox isn't even a true pox virus. It's caused by a herpes virus, the same family responsible for the cold sores around your mouth and genital herpes. It was likely named chickenpox to make it less frightening for children, as in, look, your body is blooming with flowers. In English, the disease is also called chickenpox, which has nothing to do with chickens. It's thought that the name comes from chickens being seen as timid animals, implying there's nothing to be scared of. These are ancient diseases, so their etymologies aren't always clear. Anyway, back to monkeypox. Monkeypox likely first infected children in Africa through the skin of small mammals they played with. Today, activities such as hunting, skinning, and cooking these small mammals in the region mean the virus can repeatedly jump to humans through contact. Unfortunately, the disease doesn't just spread from animals to humans, it can also spread from human to human, which is why it can lead to global outbreaks. The first human cases of monkeypox were identified in the Democratic Republic of Congo in 1970. Since then, the virus has spread to various parts of Africa and occasionally to other continents through international travel. There are two main variants of the monkeypox virus: the Central African Congo Basin clade and the West African clade. The Central African clade is known to cause more severe disease and has a higher mortality rate compared to the West African clade. Both clades can spread through direct contact with infected animals, human-to-human transmission, and contaminated materials. Symptoms of monkeypox include fever, headache, muscle aches, and a distinctive rash that turns into fluid-filled lesions. While there is no specific treatment for monkeypox, supportive care and antiviral medications can help manage symptoms and prevent complications. Vaccination against smallpox has been shown to provide some protection against monkeypox, and new vaccines are being developed to specifically target the virus. Public health measures such as isolation of infected individuals, contact tracing, and good hygiene practices are crucial in controlling outbreaks. International cooperation and surveillance are essential in preventing the spread of monkeypox and protecting public health. Ongoing research is vital to better understand the virus, develop effective treatments, and improve vaccines. Educating communities about the risks and prevention methods is key to reducing the impact of monkeypox outbreaks. With continued efforts and advancements in science, we can hope to control and eventually eliminate monkeypox as a public health threat. The main mode of transmission for monkeypox is direct skin contact. The virus enters the body through visible or invisible cracks in the skin when a person carrying the virus touches someone who isn't yet infected. There are many ways for the virus to reach these cracks. Shaking hands with an infected person, being coughed on, engaging in sexual contact, or touching the scabs from the lesions caused by the virus. What makes Enox sneaky is that, unlike COVID, symptoms don't appear in just 5 to 21 days, but can take 5 to 21 days to manifest. However, this isn't a major problem because, unlike COVID, asymptomatic cases, people who haven't yet developed symptoms, don't seem to spread the disease much. Still, there's data suggesting some level of asymptomatic transmission. When symptoms appear, they often start with general flu-like signs such as fever, fatigue, headache, and muscle aches. These symptoms can persist for a few days before more specific signs of monkeypox become evident. The hallmark symptom is a rash that progresses through several stages. It starts as flat spots, then becomes raised bumps, then fluid-filled blisters, then pustules, and finally scabs before healing completely. The lesions can appear anywhere on the body, but are most commonly found on the face, hands, feet, and genitals. In many cases, the rash and accompanying symptoms resolve within 2 to 4 weeks, without the need for intensive medical intervention. However, in some individuals, particularly those with compromised immune systems, the elderly, young children, and pregnant women, the disease can cause severe complications, including secondary infections, sepsis, or even death. Monkeypox can also be transmitted through respiratory droplets during prolonged face-to-face contact. Additionally, the virus can spread through contact with contaminated objects such as bedding, clothing, and surfaces. Another symptom to watch for is swollen lymph nodes, which can occur in the neck, armpits, or groin. The rash can be particularly painful and itchy, adding to the discomfort of the infected individual. In severe cases, the rash can cover large areas of the body and require medical attention to manage the symptoms. Facial lesions can be particularly distressing and may lead to scarring if not properly treated. Lesions on the hands can make everyday tasks difficult and painful. Lesions on the feet can make walking and standing uncomfortable. Lesions on the genitals can cause significant discomfort and may require medical treatment. Recovery from monkeypox can be a slow process, but with proper care, most individuals will fully recover without long-term effects. Treatment focuses on relieving symptoms and preventing complications, with supportive care being the mainstay of management. Vaccination can help prevent monkeypox, and those at high risk should consider getting vaccinated. Good hygiene practices, such as regular hand washing and avoiding contact with infected individuals, are crucial in preventing the spread of monkeypox. Public health measures, including wearing masks and social distancing, can also help reduce the risk of transmission. With awareness and proper precautions, we can manage and prevent the spread of monkeypox effectively. Monkeypox is not as contagious as diseases like COVID-19 or the flu. It doesn't spread through casual encounters or by simply walking past an infected person. Close, sustained contact is typically required for transmission. This is why outbreaks are often localized and easier to contain with proper public health measures, such as isolation of cases and vaccination. Fortunately, vaccines and treatments are already available for monkeypox. Because the virus is so closely related to smallpox, the smallpox vaccine offers significant protection against monkeypox as well. Studies suggest that the smallpox vaccine is about 85% effective in preventing monkeypox infection. Those who are vaccinated after exposure to the virus may also have a milder form of the disease, provided the vaccine is administered within a few days of exposure. In addition to vaccines, antiviral medications like tecovirimat, commonly known as TPOXX, have been developed specifically to treat pox viruses. While not widely used, these treatments can be life-saving for severe cases or those at high risk of complications. Now, let's discuss what makes the current outbreak unique. Unlike previous outbreaks, which were mostly confined to rural areas in Africa and were relatively limited in spread, this outbreak has seen significant transmission in urban settings and across continents. One factor contributing to this is the mode of transmission. The virus appears to have established a foothold in certain social networks where close, prolonged contact is common. For instance, in 2022, many of the cases were reported among men who have sex with men. This doesn't mean the virus exclusively affects this group. Anyone can get infected. However, understanding the patterns of transmission helps public health officials target prevention and education efforts more effectively. Another difference is the global context. The world is still recovering from the COVID-19 pandemic, which has left many healthcare systems overstretched. As a result, the ability to quickly detect and contain outbreaks may be hampered in some regions. To combat this, public health officials are ramping up efforts to educate the public on prevention measures, such as avoiding close contact with infected individuals and practicing good hygiene. Community outreach programs are being implemented to ensure that information reaches all demographics, especially those in high-risk areas. International collaboration is also crucial as countries work together to share data and resources to control the spread of the virus. The lessons learned from the COVID-19 pandemic are being applied to improve global health responses and ensure better preparedness for future outbreaks. Vaccination campaigns are being intensified with efforts to ensure that vaccines are accessible to all, especially in regions with limited healthcare infrastructure. The goal is to achieve widespread immunity and prevent further spread of the virus. Public health officials continue to monitor the situation closely and are prepared to implement additional measures as needed to protect public health. Ongoing research is essential to understand the virus better and develop more effective treatments and vaccines. With continued vigilance and cooperation, we can overcome this outbreak and safeguard public health. If you suspect you've been exposed to monkeypox or are experiencing symptoms, it's important to seek medical advice promptly. Early diagnosis can reduce the risk of spreading the virus to others and ensure you receive appropriate care. Vaccination is another powerful tool. If you're in a high-risk group or live in an area with reported cases, check with local health authorities about vaccine availability. Basic hygiene practices, like washing your hands regularly, avoiding close contact with infected individuals, and refraining from touching your face can significantly reduce your risk of infection. That's the gist of it. With proper awareness and public health measures, there's no reason for widespread panic. The key is vigilance, timely intervention, and empathy for those affected. If you found this video informative, don't forget to like, share, and subscribe. Let's keep learning together and stay prepared for whatever challenges come our way. Take care and see you in the next video. Remember, staying informed and practicing good hygiene are key steps in protecting yourself and others. Get involved in community outreach and health education to help spread awareness. Regularly monitor your health and seek medical advice if you notice any symptoms. Follow health guidelines, wear masks, and practice social distancing to minimize risk. Show empathy and support to those affected by the outbreak. Stay updated with the latest health information and share it with others. Together we can overcome this challenge with knowledge, care, and community effort.